Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is Manoj Singh Rana, and with me is Nipunika Shahid, bringing glimpses of major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment, and more. As the world fights the COVID-19 pandemic, we begin the program with a message of caution to stay safe and protected by following these 3 simple steps. Wear a face mask, maintain social distancing, and focus on hand and face hygiene. The headlines. Prime Minister Narendra Modi assures that every success of India will help the world to succeed, and Atmanirbhar Bharat mission is fully committed to global good and global supply chain. Sri Lanka and Bahrain receive India-made COVID-19 vaccines. India flattens its COVID-19 curve. Over 2.8 million people administered COVID-19 vaccines. WHO experts to begin investigations into the origin of COVID-19 from Chinese city of Wuhan. Pakistan Supreme Court orders the release of militant convicted of beheading US journalist Daniel Pearl. And in football, Barcelona defeats Rayo Vallecano 2-1 to reach Copa del Rey quarter-final. Prime Minister Narendra Modi has said in the midst of numerous doubts, India took a proactive public participation approach and developed a COVID-specific health infrastructure and trained its resources to fight COVID-19. Addressing World Economic Forum's Davos dialogue via video conferencing this evening, Mr. Modi said India is successfully conducting the world's largest vaccination drive as well. He said when the pandemic began, someone had even predicted that 700 to 800 million would be infected, and someone had said that over 2 million Indians would perish. Mr. Modi pointed out that looking at the condition of countries with better health infrastructure, the world was right in worrying about India. However, India took a proactive public participation approach and developed a COVID-specific health infrastructure and trained its resources to fight COVID.
भारत ने खुद पर निराशा को हावी नहीं होने दिया। भारत प्रोएक्टिव पब्लिक पार्टिसिपेशन के अप्रोच के साथ आगे बढ़ता रहा। हमने कोविड स्पेसिफिक हेल्थ इंफ्रास्ट्रक्चर डेवलप करने पर जोर लगाया। हमने अपने ह्यूमन रिसोर्सेज को कोरोना से लड़ने के लिए ट्रेन किया। टेस्टिंग और ट्रैकिंग इसके लिए टेक्नोलॉजी का भरपूर इस्तेमाल किया। इस लड़ाई में भारत के प्रत्येक व्यक्ति ने धैर्य के साथ अपने कर्तव्यों का पालन किया। कोरोना के खिलाफ लड़ाई को एक जन आंदोलन में बदल दिया। आज भारत दुनिया के उन देशों में से है जो अपने ज्यादा से ज्यादा नागरिकों का जीवन बचाने में सफल रहा है।
The Prime Minister said India is not only fulfilling its needs of PPE kits and masks, but also exporting and helping other countries.
कोरोना शुरू होने के समय मास्क, पीपीई किट, टेस्ट किट हम बाहर से मंगाते थे। आज हम न सिर्फ अपनी घरेलू जरूरतें पूरी कर रहे हैं, बल्कि इन्हें अन्य देशों में भेजकर वहां के नागरिकों की सेवा भी कर रहे हैं। और आज भारत ही है जिसने दुनिया का सबसे बड़ा कोरोना वैक्सीनेशन प्रोग्राम भी शुरू किया है।
He said India has vaccinated over 2 million health workers in record time. In the next few months, India would complete its target of vaccinating 300 million old people and people with comorbidities.
भारत की स्पीड का अंदाजा आप इसी से लगा सकते हैं कि सिर्फ 12 दिन में 12 डेज में भारत ने अपने 2.3 मिलियन से ज्यादा हेल्थ वर्कर्स को वैक्सीनेट कर चुका है। अगले कुछ महीनों में हम अपने करीब 300 मिलियन बुजुर्ग और कोमॉर्बिडिटी वाले मरीजों के वैक्सीनेशन का टारगेट पूरा कर लेंगे।
Mr. Modi said India also has shown the world how traditional medicine like Ayurveda can help in improving immunity. He further stated that today India is sending its vaccine to several countries and is helping in developing the infrastructure for successful vaccination, thus saving lives of citizens of other countries.
भारत की ट्रेडिशनल मेडिसिन आयुर्वेद कैसे इम्यूनिटी बढ़ाने में सहायक है, हमने दुनिया को इस बारे में गाइड भी किया। आज भारत कोविड की वैक्सीन दुनिया के अनेक देशों में भेजकर वहां पर वैक्सीनेशन से जुड़े इंफ्रास्ट्रक्चर को तैयार करके दूसरे देशों के नागरिकों का भी जीवन बचा रहे हैं। और ये सुनकर WEF में सभी को तसल्ली होगी कि अभी तो सिर्फ 2 मेड इन इंडिया कोरोना वैक्सीन दुनिया में आई है। आने वाले समय में कई और वैक्सीन भारत से बनकर के आने वाली है।
The Prime Minister said India's upcoming vaccines will help other countries at a swifter pace to fight the pandemic. He said even on the economic front, the situation is set to change in the post-COVID era. He added that India continued its economic activities during COVID with infrastructure work worth trillions of rupees, providing employment. He said India stressed on saving every single life and is now working ahead to become Atmanirbhar.
दुनिया के अर्थ जगत को ये भरोसा भी दिला रहा हूं कि आर्थिक मोर्चे पर भी स्थितियां अब तेजी से बदलेगी। कोरोना के समय में भी भारत ने इंफ्रास्ट्रक्चर के ट्रिलियंस ऑफ रुपीज के प्रोजेक्ट शुरू करके एम्प्लॉयमेंट के लिए विशेष स्कीम्स चलाकर इकोनॉमिक एक्टिविटी को बनाए रखा था। तब हमने एक एक जीवन को बचाने पर जोर दिया।
He said 1.3 billion people of India have Aadhaar, which is connected to their accounts. In December last year, UPI has seen transactions worth 4 trillion rupees. Mr. Modi said people in the banking sector know how countries worldwide are trying to replicate the UPI system developed by India. He also said India is starting a new initiative to provide a unique health ID to 1.3 billion citizens for easy access of healthcare. He also assured that every success of India will help the world to succeed, and Atmanirbhar Bharat mission is fully committed to global good and global supply chain. Prime Minister Modi said India has stressed a lot on reforms and incentive-based stimulus in recent times. He pointed out that even during COVID, India has faced structural reforms in all sectors. These reforms are being supported by PLI schemes. He also said COVID crisis has taught the basics of human values and that Industry 4.0 is for humans and not robots. He cautioned that it must be ensured that technology becomes a tool for ease of living and not a trap. The Davos Dialogues agenda marks the launch of the World Economic Forum's Great Reset initiative in the post-COVID world.
The consignments of Made in India COVID vaccines dispatched by India have reached Sri Lanka. In a tweet, External Affairs Minister Dr. S. Jaishankar termed Sri Lanka as a dependable partner and reliable friend. This gift of COVID-19 vaccines to Sri Lanka is a part of India's Vaccine Maitri initiative, under which India has gifted vaccines to 7 other countries in the region. This humanitarian gesture amid the pandemic showcases India's commitment to its neighbourhood first policy and Saga doctrine, in which Sri Lanka has a prominent position.
Today we are in conversation with Mr. Eldos Matthew Punus, the spokesperson of the High Commission of India, Colombo, Sri Lanka, in an exclusive interview to All India Radio. The first tranche of vaccines has arrived in Colombo today. What are your first reactions to this gesture?
As you are aware, 500,000 doses of vaccine manufactured in India was delivered to Sri Lanka as a gift under Government of India's flagship Vaccine Maitri program. The breadth as well as the depth of India's multi-dimensional partnership with Sri Lanka makes this relationship unique. The two neighbors are connected by millennia-old ties. Commonalities run across spheres. People-to-people connect binds the two nations. India has always been a dependable partner for Sri Lanka and will remain so. Development projects carried out by India are guided solely by the priorities of Government of Sri Lanka. We have been able to make a meaningful impact on lives of the people of Sri Lanka in diverse areas. Housing, health and community development are just some of the sectors in which we were able to make a palpable impact. It is natural that Sri Lanka was one of the first recipients of vaccine from India. It is indeed noteworthy that India is the first country to deliver vaccine in Sri Lanka. High Commission of India is happy that we were able to play a part in making this delivery happen. We hope that this consignment could act as a shield to the Sri Lankan frontline healthcare workers and other personnel who are directly involved in battling in what is probably the biggest pandemic that we may witness in our lifetimes. This would also help in reviving Sri Lanka's economy, we hope.
Right, and how has Sri Lanka dealt with the challenge of COVID?
Prime Minister Narendra Modi had complimented Sri Lanka's leadership on containing the pandemic. The first wave of COVID-19 in the country was fairly contained. Measures such as isolation and contact tracing were effective. The second phase was more challenging. Sri Lanka faced this with resilience and has seen economic activity and several economic indicators picking up. The arrival of Indian vaccine will also lift morale and confidence.
And what is the sense that prevails in the nation now that the vaccination is around the corner?
Humanity in general was eagerly awaiting COVID-19 vaccine. It was no different in Sri Lanka. Vaccine has come with hope for many, especially the frontline healthcare workers in the country. Government of Sri Lanka has been appreciative of India's gesture to deliver vaccine as a gift.
In what other ways has India supported Sri Lanka in its efforts to end the scourge of the pandemic?
I must mention that bilateral ties between the two countries diversified into newer areas during the pandemic. In that sense, the two countries have been able to convert the challenge into an opportunity. Various capacity building programs were offered by India online, including for medical professionals during the pandemic. Specifically, in containing the spread of the disease, 4 consignments of medical supplies weighing around 26 tons were donated by India to Sri Lanka. As in case of vaccine delivery, India was the first responder in averting a potentially huge oil spill from empty New Diamond vessel. It was a joint battle by the two friendly countries against the pandemic. The fact that India and Sri Lanka are the largest contributors to the COVID-19 Emergency Fund for SAARC, which was the brainchild of our Prime Minister, attests to this. Our efforts to stand by Sri Lanka at times of need will continue.
Thank you so much, Mr. Punus, for taking time out to help our listeners learn more about the cherished friendships between India and Sri Lanka. You were listening to Mr. Eldos Matthew Punus, the spokesperson of the High Commission of India, Colombo, in conversation with All India Radio. Sri Lankan President Gotabaya Rajapaksa has thanked Prime Minister Narendra Modi for providing 500,000 COVID-19 vaccines to the island nation. He also thanked the Indian citizens for the generous attitude shown to the Sri Lankan people in such testing times.
As a friendly gesture in view of excellent relations existing between India and Bahrain, a gift consignment of 100,000 dosages of Made in India Covishield vaccines has reached Kingdom of Bahrain under the Vaccine Maitri initiative. India has gifted over 5 lakh doses of COVID-19 vaccines to its neighbours and extended neighbourhood since the 20th of January this year. This includes 1.5 lakh doses to Bhutan, 1 lakh to Maldives, 10 lakh to Nepal, 20 lakh to Bangladesh, 15 lakh to Myanmar, 1 lakh to Mauritius, 50,000 to Seychelles, 5 lakh to Sri Lanka and 1 lakh to Bahrain. Briefing media this evening, External Affairs Ministry spokesperson Anurag Srivastava said these supplies are based on requests from these countries. Over the next few days, India plans to gift further quantities of 1 lakh doses to Oman, 5 lakh to CARICOM countries, 2 lakh to Nicaragua and 2 lakh to Pacific Island states.
Further supplies on a commercial basis are likely to take place to Saudi Arabia, South Africa, Canada, Mongolia and other countries. Further, we are going to supply 1 crore doses to Africa and 10 lakh doses to UN health workers under Gavi's COVAX facility.
Mr. Srivastava said there is interest in many countries in accessing vaccines from India. In line with the Prime Minister's announcement that India sees international cooperation in the fight against the COVID-19 pandemic as its duty, country has played the role of the first responder in the neighbourhood as well as undertaken supplies to countries beyond. Commercial exports have taken place to Brazil, Morocco and Bangladesh. Further commercial supplies are likely to reach Saudi Arabia, South Africa, Canada and Mongolia. Mr. Srivastava said India's external supplies, whether as gifts or on a commercial basis, are based on domestic availability, licensing issues and regulatory approvals in the countries concerned. He said India will continue to supply vaccines to partner countries over the coming weeks and months in a phased manner. He added that decisions on these supplies will be calibrated against the requirements of the rollout of the COVID-19 vaccine at home.
Health and Family Welfare Minister of India, Dr. Harshvardhan, chaired the 23rd meeting of the high-level group of ministers on COVID-19 by video conference on Thursday. He said that less than 12,000 cases were reported in the last 24 hours and the active caseload has reduced to just 1.73 lakhs. Dr. Harshvardhan said India has flattened its COVID-19 curve and 146 districts have no new cases since last 7 days.
Our recovery rate is almost touching 97% today morning. To be precise, it is 96.93%, and our fatality rate continues to be the lowest in the whole world, so almost 1.44%. Last 24 hours, we had 11,660 cases in the whole country.
India has vaccinated more than 2.8 million beneficiaries under the country-wide COVID-19 vaccination exercise till date. The Union Health Ministry said in the last 24 hours, nearly 5 lakh people were vaccinated across 9,994 sessions. Meanwhile, the country's COVID-19 recovery rate reached 96.91% with a total recovery of more than 13,000 patients in the last 24 hours.
External Affairs Minister of India, Dr. S. Jaishankar, has said that the face-off events in eastern Ladakh last year have profoundly disturbed India's relationship with China. He said the incident at LAC not only signalled disregard for commitment on minimizing troops, but also showed willingness to breach peace and tranquility. Delivering the keynote address at the 13th All India Conference of China Studies through video conferencing, the minister said, with all the difference and disagreements on boundary issue with China, the border areas still remain fundamentally peaceful. The last loss of life at Indo-China border before 2020 was way back in 1975. He said that is why the events in eastern Ladakh last year have profoundly disturbed the relationship. He added that India is yet to receive a credible explanation for the change in Chinese stance and reasons for amassing of troops at LAC. Dr. Jaishankar said far from mitigating differences, events of 2020 have actually put the ties between the two countries under exceptional stress. The minister also said development of ties can only be based on mutuality like mutual respect, mutual sensitivity and mutual interest. He underlined that any expectation that situation at border can be brushed aside and life can carry on undisturbed is not realistic.
I don't really have to remind you what impact this has had on both public and political opinion in our country. Significantly, to date, we have yet to receive a credible explanation for the change in China's stance.
This is All India Radio giving you the world news.
All India Radio presents World News. News and views from across the globe. What happened and what is up next? The newsmakers and the highlights of the day. From 10:30 to 11 p.m. every night on 100.1 FM, All India Radio.
The World Health Organization, WHO, has said that COVID-19 vaccines are a global public good. WHO reiterated that vaccines should be shared equitably between poor and rich nations to help end the pandemic. The WHO's Europe Director, Hans Klug, said that vaccine manufacturers were working non-stop to plug shortfalls in supplies to countries struggling to contain the COVID-19 pandemic. He was addressing an online media briefing along with WHO Europe vaccination expert Siddharth Datta about delays in expediting Pfizer and AstraZeneca vaccines to patients across the European Union. Mr. Klug appealed to the governments and manufacturers to cooperate in addressing teething problems in the rollout. The World Health Organization WHO team of 13 experts has left the quarantine on Thursday to begin their fieldwork and research on the origins of COVID-19 in Wuhan 2 weeks after arriving in the Chinese city where the virus emerged in late 2019. The team's arrival was delayed due to concerns over access and terms of reference of research, which saw bickering between the US and China. Over the past 2 weeks, the team has been interacting with each other and Chinese scientists through video calls. Our Beijing correspondent has filed this report.
The team, which is expected to work for next 2 weeks, will conduct field trips, conduct visits and seminars, but there is no clear-cut agenda available publicly. The team will try to build upon the work done and data provided by the Chinese scientists. The WHO has tried to manage the expectations from the investigation, stressing that it is not about apportioning blame, but about understanding how the virus made the jump to humans and finding ways to prevent the emergence of similar pathogens. Several countries, most vocally the United States and Australia, have accused Beijing of downplaying the outbreak's severity during its early stages. China has been pushing a narrative that the virus existed abroad before it was discovered in Wuhan, with state media citing the presence of the virus on imported frozen food packaging and advancing alternate theories about the virus origin. In Geneva last week, the head of the US delegation to WHO called on China to allow the team to Wuhan access to caregivers, former patients and lab workers, and to share all scientific studies into animal, human and environmental samples taken from a market in Wuhan. It remains to be seen what actually comes out in next 2 weeks and whether the team will be allowed to stay for a longer duration if any such situation arises. Anshuman Mishra for World News, All India Radio, Beijing.
The United States has rejected China's maritime claims in the South China Sea beyond what it is permitted under Law of the Sea Convention 1982. U.S. Secretary of State Antony Blinken said that U.S. stands with Southeast Asian nations resisting China's pressure in the South China Sea. Blinken made the remarks in a call with Philippine Foreign Minister Teodoro Locsin. Blinken's assurances came after Locsin said on Wednesday that the Philippines had filed a diplomatic protest over China's passing of a law allowing its Coast Guard to open fire on foreign vessels. Pakistan's Supreme Court has ordered the release of a militant convicted of beheading U.S. journalist Daniel Pearl. Pearl was investigating Islamist militants in Karachi after the September 11, 2001 attacks on the United States when he was kidnapped. His case grabbed headlines globally after a video of his beheading emerged weeks after he was abducted. Ahmad Omar Saeed Sheikh, who was the main suspect in the 2002 kidnapping and murder of Wall Street Journal reporter Pearl, has acquitted by a panel of 3 judges. A Pakistani High Court last year commuted the death penalty of the British-born Sheikh into a life sentence and acquitted his 3 co-accused, citing lack of evidence.
India has said that Pakistan has failed to create an environment under which the allegations against Kulbhushan Jadhav can be seriously and effectively challenged. Replying to a media query this evening, External Affairs Ministry spokesperson Anurag Shrivastava said Pakistan needs to implement the ICJ judgment in letter and spirit. This includes provision of all relevant documents to the case as well as providing unconditional, unhindered and unimpeded consular access to Mr. Jadhav. On acquittal of Umar Saeed, Mr. Shrivastava pointed at the very low conviction rate in Pakistan when it comes to sentencing of terror accused. He said this case truly demonstrates Pakistan's intent on taking action on the terror front. He called it as a travesty of justice not to find Umar Saeed guilty of any charges in the heinous act of terror. He said India's position on Pakistan taking sustained, verifiable, credible and irreversible action against terrorism and terrorist funding emanating from all territory under its control remains unchanged. Replying to a query on activities of Khalistani elements, the spokesperson said India is closely engaged with the relevant foreign governments to apprise them of the threats posed and convey concerns as well and to seek their interventions. He said the safety and security of the Indian diplomatic premises and personnel is the responsibility of the host government. India and Japan held the 5th joint meeting of the India-Japan Act East Forum in New Delhi on Thursday. The meeting was co-chaired by Foreign Secretary Harshvardhan Shringla and Ambassador of Japan to India, Suzuki Satoshi. The Act East Forum reviewed progress of ongoing projects in the northeastern region of India in various areas including connectivity, hydropower, sustainable development, harnessing of water resources and skill development. They discussed several ongoing new projects under India-Japan bilateral cooperation and also exchanged views on cooperation in new areas such as healthcare, agro-industries and SMEs, bamboo value chain development, smart city tourism and people-to-people exchanges. Foreign Secretary and the Japanese Ambassador appreciated the role played by the Act East Forum, since its establishment in 2017 in streamlining India-Japan bilateral cooperation for the modernization of Northeastern region. The ACT East Forum provides a forum and a platform for India-Japan collaboration in the Northeastern region under India's ACT East policy and Japan's vision for a free and open Indo-Pacific.
India's Rafale squadron added third batch of 3 fighter jets which arrived last night after flying non-stop from France. Indian Air Force said the third batch of 3 Rafale aircraft landed at an IAF base a short while ago. They flew over 7,000 kilometers with in-flight refueling. The aircraft got airborne earlier in the day from France. The new jets will bolster the strength of the Indian Air Force's only Rafale squadron, which is based in Ambala. This is the third set of deliveries of the aircraft to the IAF. India ordered 36 warplanes from France in September 2016 for 59,000 crore rupees under a government-to-government deal. With the new jets, the number of Rafales in the IAF's inventory has increased to 11. The National Security Advisors of India held a telephonic conversation on Wednesday. In a statement, White House said the U.S. NSA James Sullivan reaffirmed President Biden's commitment to a strong and enduring U.S.-India strategic partnership based on shared commitment to democracy. They discussed the importance of continuing close cooperation in the Indo-Pacific region, promoting regional security and renewing efforts to collaborate on global challenges, including COVID-19 and climate change.
Defence Minister of India Rajnath Singh spoke to U.S. Defence Secretary Lloyd J. Austin. Mr. Singh conveyed wishes to his U.S. counterpart on his appointment. Both leaders reiterated their firm commitment to deepen India-U.S. defence cooperation. Mr. Singh said they also exchanged views on regional and global issues of mutual interest to strengthen this strategic partnership.
Now let us take a look at the major developments around the world as reported in the foreign press. The New York Times has reported that President Biden will use executive action to reopen enrollment in Obamacare. Wall Street Journal writes that European Union and AstraZeneca has clashed over delivery of the vaccines amid shortfall in Europe. According to The Guardian, a World Health Organization team will start fieldwork in a fact-finding mission on the origins of the virus that caused the COVID-19 pandemic. Sputnik News has reported that UK has announced purchase of 60 million jabs of promising new Valvina vaccine. The Himalayan Times writes that craze to learn Sanskrit language is increasing among all sections of society.
Moving on to sports, in football, Barcelona defeated Rayo Vallecano 2-1 to reach Copa del Rey quarter-final. Juventus defeated Spal 4-0 to reach semi-finals of the Italian Cup. In BWF World Tour finals, PV Sindhu lost 6-18-21, 13-21 to Ratnachok Infernon. Indian player Kidambi Shrikant lost 21-19, 9-21, 19-21 to Wang Su Wei. Saurav Ganguly, the Board of Control for Cricket in India BCCI President, underwent a successful angioplasty at the Woodlands Hospital in Kolkata. And let's take a look at the headlines once again. Prime Minister Narendra Modi assures that every success of India will help the world to succeed, and Atmanirbhar Bharat mission is fully committed to global good and global supply chain. Sri Lanka and Bahrain receive India-made COVID-19 vaccines. India flattens its COVID-19 curve. Over 2.3 million people administered COVID-19 vaccines. WHO experts to begin investigations into the origin of COVID-19 from the Chinese city of Wuhan. Pakistan Supreme Court orders the release of militant convicted of beheading US journalist Daniel Pearl. And in football, Barcelona defeats Rayo Vallecano 2-1 to reach Copa del Rey quarter-final.
India is celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let us listen to his favorite bhajan, Vaishnavajan, by artists from Sri Lanka.
Vaishnavajan to tene kahiye je, peer parai jaane re, par dukh ke upkar kare to ye man abhiman
And with that, we end this bulletin. See you at same time tomorrow with the next edition of World News.